Welcome to section 5 of our chapter on immunodeficiencies. In this section, we'll be discussing IL-12 receptor deficiency. Let's get started. Before we discuss the image mnemonic, I think it would be helpful to take a step back and understand the role of IL-12, specifically with regards to TB. We discussed this image in great detail in our TB video in microbiology, and here it is again for your review. As you can see, it outlines the pathophysiology of TB. I'm not going to walk through the entire image, but notice that an organism is inhaled through aerosolized droplets, engulfed by alveolar macrophages, and then travels to the lymphatic system. From here, the macrophages present TB antigens on their surface to naive T cells. The macrophage produces IL-12, which induces naive T cells to become T helper type 1 cells, or Th1 cells. Th1 cells then release interferon gamma, and this is a crucial cytokine responsible for fully activating macrophages. In other words, it helps macrophages form granulomas and destroy bacteria. So you could imagine that if the IL-12 receptor was deficient, then naive T cells would be unable to become Th1 cells. This would result in decreased interferon gamma, and macrophage activation would be impaired. And this is exactly what happens in IL-12 receptor deficiency. Okay, so now that you understand these ideas conceptually, let's help you memorize them with an image mnemonic. This scene will take place inside of a house near the laundry room. We can see that this guy is replacing the wood floors here, and if we look closely at his watch, we can see that it's 12 o'clock. He's looking at his watch and now noticing the time in excited anticipation of eating his lunch. We can see his lunch waiting off to the side right here. In any case, the 12 o'clock time, along with the lunch reference, is here to help you think of the number 12. Also, just like with other videos, the interlocking wooden floors should help you think of interleukin. So putting these ideas together should help you remember that this image is all about IL-12 receptor deficiency. Next, notice that we've shown this guy's son, who is supposed to be helping with the floors, but he appears a bit distracted playing some video games. If we zoom up a bit and look at his video game screen, we can see that there is a warrior guy with a T-shaped flail fighting a monster. The T-shaped flail should help you remember that this is a T-cell disorder. We can also see that the warrior has a servant squire guy that follows him around and helps him fight monsters. The helper guy also has Th1 written on his shirt. These references to helping and Th1 are here to help you remember that in this disorder, there is a decreased Th1 response. Now, to add to this yummy lunch, you can see that we've added some Reese's Pieces Buttercups. The Reese's are a symbol for autosomal recessive and are here to help you remember that this is an autosomal recessive condition. Now, if you look closely at the rest of the lunch, you'll notice that there are a lot of tubers, like carrots, potatoes, and beets. Recall from our microbiology videos that tubers are a symbol for Mycobacterium tuberculosis. We've included them in this image to help you remember that patients with IL-12 receptor deficiency present with disseminated mycobacterial infections. Next, you can see that we've added some mushrooms to the lunch. Mushrooms are a type of fungus, so we've included them here to help you remember that this disorder can also present with disseminated fungal infections. Now, this is a laundry room, so notice that we've added a bottle of Clorox and a syringe that was used to spray the clothes with the bleach. In any case, the syringes are symbol for vaccines, and the syringe next to the tubers should make you think of a Mycobacterium tuberculosis vaccine, which is the BCG vaccine. This is a live attenuated vaccine that is commonly administered outside of the US, and patients with an IL-12 receptor deficiency may present after administration of the BCG vaccine. Now you can see that we've shown some clothes inside of the washer. Looks like some fancy leopard design clothing is getting washed. This leopard reference should help you remember that patients may also present with disseminated Mycobacterium leprae infections. Finally, you can see that we've shown some cracks in the washer extending up to some dim green lights. I guess this whole area of the house needs some tender love and care, not just the wood floors. Anyway, the green lights should make you think of gamma rays or interferon gamma. And the cracks should make you think that this is broken or low. So patients with IL-12 receptor deficiency will have low levels of interferon gamma. All right, that's all you need to know regarding IL-12 receptor deficiency.